again we are in the press to present one more thing. So this is slightly different from what we have done in the past. So this is very interesting case because the moment the patient came to the OPD, I was under shock seeing the patient. Where we asked the patient to sit, he is standing beside the chair of the chair height. So I slightly got confused what to do with him. So his initial complaints were knee pain, but the knee pain is going for many years. And the more interesting, so initially we thought he would settle down with simple pain medication. He's taking this medication for last 5-6 years, and he's doing all kind of physiotherapy, but his pain problem is not settling. So then I thought, let me go a little bit deeper into it. And then I realized that his length, what he has, is because of already a previous surgery being done on his knee. So that makes things more complicated. It is not a virgin knee. It has already been handled by a surgeon in the past. So that is much more challenging to address. And then we thought we'll go a little bit into investigation. So when we started investigating, we realized that it is not just his knee, it is his hip also facing a problem. His overall lower limb alignment is slightly bent inside, that is what we call varus. But this bend is compensatory to the problem what he has in the hip joint. So normally we have done plenty of surgeries like this with the deformity, we have corrected it. But in this patient, it is a compensatory deformity which is helping him to move on. So correcting this deformity completely will also give him problem. Had crossed many number of patients we had done with these surgeries. So we thought, yes, this can be an easy thing to go with the robo. So we tried to proceed with the robotic surgeries. So similar varus bend patient who had difficulty in walking, so they were comfortably corrected by our robotic surgeries. Okay, so we have plenty of examples like this, wherein this patient, what you see, is having more than 20 degree deformity with multiple loose bodies in the knee which were removed, and then he was comfortable walking. And there is one more patient, we have already talked about this guy. He had a femoral implant in his knee, and that was also corrected without taking out the implant. So these are the advantages that we are already experienced with. So that's why we thought we'll take this challenge. And in this robo, many of the time we plan the surgery, we exactly know where the implant sits and how it will be sitting inside the body. So when we try to plan, the same thing I had spoken in a few of my article on the paper. So similarly, a patient with severe varus deformity, when this varus deformity was comfortably corrected by our robotic surgeries. In patients with severe deformed knee also was comfortably corrected by the knee replacement surgery with the robotic help. And similar problems in the hip were also addressed by robotic surgeries. So with all this experience, now we thought this is a simple job to correct the deformity. We tried to plan the surgery. When we started planning for the surgery, then I realized I'm in big soup. So that is mainly because the femoral size, or the smallest size of femoral implant, is not sitting into this patient. So since we had planned for robotic surgery, I had to do pre-planning. When I'm planning, I realized, then I thought, let me go into. Then I spoke to my colleague, Dr. Abhinandan, and I spoke to few of my friends, and then I presented this case in a Madurai conference also. There they said, yes, presently there are no implants of his size, so it has to be designed separately. So after discussion with all our friends, colleagues and conference, then I try to replan. You can see there is a little bit of overhang which would be problematic for the patient. And on the femur, the one more challenging thing is it is not a normal femur. The femur on the outer side has grown less, femur on the inner side has grown more. So this becomes much more challenging. And then when the conference we are discussing, then few of my colleagues suggested that it should be a patient specific implant. And then we inquired with few of the companies. They said this small size of design is not possible. Then luckily I got a person from orthotic who said that yes, we can do it provided you give us the idea, give us the details of the patient and give us the dimension what you want. So all these details need to be given, then we can plan and do the surgery. And then I thought, yes, we will go with this. And when I came back from the conference, I spoke to our director, Dr. Dilip. So he was our financial manager. So he said that yes, this thing can be done. Somehow we will help it. Only thing is patient should be 100% benefited. So this is much more like challenging for me. So I have to give a guaranteed results. So then we went again, went into depth of it. Then we realized that since the femur is deformed, there are other problems to it added to it. There were ligaments which are imbalanced. So we need to address these ligaments also, or you have to correct the rotation so that there is no stress on the ligament. So I spoke to one of my colleagues, Dr. Prashant Tejwani, who handles ligamentous injuries. Then he said at this age, correcting the ligaments is much more riskier. It is better to correct with the implant only. And then the deformity also, when we discussed with our deformity surgeon, Dr. Pushottam, so he was also of the opinion that it has to be a customized implant only without correcting other deformities. That's when we finally decided that we will go with the patient specific implant that keeps the native bone structure and does not give stress on the ligament. So this was a specialized implant which is particularly designed for this patient so that this implant will not trouble any of other his body parts. That even included his spine also. Patient has some problem in his spine, so that would also get affected his walking style or ligament stress changes. So when we discussed with our spine colleagues, they were of the opinion that we should go with the patient specific implant. But with all this discussion, then finally we decided to go with the implant. So this was his view of his spinal problem. This is how we discussed with the patients. And at end we try to get other implant which is a smaller size. And in market, the smallest size available was more than 5 centimeter in dimension, but his femur was less than 4.5. So then we customized the implant, and this implant that you can see, this is the bone model what we prepared. On that bone model, we made the cut, and practically we did a surgery on bone model, so that there our confusion and clarification everything became clear, and then we thought we'll proceed with the surgery. Since these were small implants, we wanted specialized instrumentation also. So orthotics helped in designing the instrumentation also. With this together, we planned the surgery. I am really thankful for our anesthesia team who would take this challenge, because his body is very short in all proportionates. So simple diclofenac injection also you cannot blindly give. You have to calculate his dosage. And in that way, anesthesia, every medicine has to be calculated and given. So that challenge was very well handled by our anesthetist. That's why we could comfortably do the surgery. And post surgery, the patient came with the results. And in a matter of 2 weeks, patient was walking comfortably. Definitely he need good amount of physiotherapy, which was efficiently done by our team. And with the team effort, at present, we have a patient who is comfortably walking. He is out of his knee issues. He can do his rituals. He can do his daily activities, and he is living a happy life.
ಗುಲ್ಬರ್ಗದಿಂದ ಬೆಂಗಳೂರು ನಾರಾಯಣ ಹಾಸ್ಪಿಟಲ್ ಬಂದಿದ್ದೇನೆ. ನಾವು ಡೈಲಿ 6 ಗಂಟೆ ದೇವಸ್ಥಾನದಲ್ಲಿ ಪೂಜೆ ಮಾಡೋಕ್ಕೆ ಬರ್ತಿದ್ದೇವೆ. 5 ವರ್ಷದಿಂದ ನಮ್ಮ ಕಾಲು ಭಾಳ ಪೇನ್ ಆಗ್ತದೆ. 2 ತಿಂಗಳಲ್ಲಿ ಭಾಳ ಜಾಸ್ತಿ ಆಯಿತು. ನಮ್ಮ ರಿಲೇಷನಲ್ಲಿ ನಾರಾಯಣ ಹಾಸ್ಪಿಟಲ್ ಕರ್ಕೊಂಡು ಬಂದಿದ್ದಾರೆ. ಡಾಕ್ಟರ್ ಪ್ರಶಾಂತ್ BN ಮೊಳಕಾಲು ಆಪರೇಷನ್ ಮಾಡಕ್ಕೆ ಹೇಳಿದ್ದಾರೆ. ಈ ಸರ್ಜರಿ ಅಂದರೆ ನನ್ನ ನೋವು ಕಡಿಮೆ ಆಗುತ್ತದೆ ಎಂದು ನಾನು ಭಾವಿಸುತ್ತಿದ್ದೇನೆ. ಆಪರೇಷನ್ ಸರಿಯಾಗಿ ಮಾಡಿದ್ದಾರೆ. 10 ದಿವಸ ಆಯಿತು. ಪಾಠ ಹಿಡಿದು ನಡೀತಿದ್ದೇನೆ. ನಾಳೆ ಡಿಚಾರ್ಜ್ ಮಾಡ್ತಿದ್ದಾರೆ.
ಊರಿಗೆ ಬಂದ್ಮೇಲೆ ಸ್ಟ್ಯಾಂಡ್ ಹಿಡ್ಕೊಂಡು ನಡೆಯೋದ್ರಿಂದ ಅವರು ಒಬ್ಬರೇ ನಡೆಯೋಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರು. ಇವಾಗಂತೂ ಏನೂ ಏನಿಲ್ಲ. ಅವ್ರ ಕೆಲಸ ಆಯ್ತು ಅವರಾಯ್ತು ಸರಿಯಾಗಿ ಮಾಡ್ತಿದ್ದಾರೆ. ನಮ್ದು ದೇವಸ್ಥಾನ ಇದೆ ಅಂಬಾಭವನಿದು, ಅಲ್ಲಿ ಪೂಜೆನೂ ಅವರೇ ಮಾಡ್ತಾರೆ. ಅವಾಗ ಸ್ವಲ್ಪ ನಿಲ್ಲೋದಕ್ಕೂ ಆಗ್ತಿರ್ಲಿಲ್ಲ. ಇವಾಗ ದಸರಾ ಮೊನ್ನೆನೆ ಜಾತ್ರೆ ಆಯ್ತು ನಮ್ಮ ಊರಲ್ಲಿ. 8 ರಿಂದ 10 ಗಂಟೆ ಮೆರವಣಿಗೆ ಇರುತ್ತೆ ಪಲ್ಲಕ್ಕಿ ಊರಲ್ಲಿ. ಆರಾಮಾಗಿ ನಡ್ಕೊಂಡು ಹೋಗಿ ತಾಯಿ ಜಾತ್ರೆ ಮುಗಿಸಿದ್ದಾರೆ.
Thankful to the hospital for giving us this opportunity, and we were able to, as a team, we were able to carry out this impossible feat, which otherwise could not have been possible because of the non-availability of standard knee replacement implants. So this is one of the only example which we can achieve in the hospital. So definitely with advancing technology and commitment from the organization, we can achieve much more than what we have achieved now. And moving forward, we look forward to achieve more of these impossible feat in the future. Thank you very much.